The city of Memphis faces a number of uphill battles this morning, from the rising number of cases of COVID-19 to the increase in violent crime this year.
This morning we are live with the mayor of Memphis, Jim Strickland, to check in on all those ongoing issues. Mayor Strickland, thank you as always for your time. Let's start with the COVID-19 surge and the really pitched battle against mandates that seem to be coming from all corners legislatively, with lawmakers calling for a special session to restrict what local governing agencies can do, to the public's protests about mask mandates and any thought of further shutdowns. We know the city of Memphis is not in charge of setting any of that, but you're obviously a leader, and we need to hear your point of view on this.
Sure, I'm always for local control. I support what the Shelby County Health Department's been doing, but the bigger issue is what the story that you showed just a few minutes ago: vaccinate. Even some of the legislators who don't want mask mandates are promoting vaccinations. It's the number one thing that you can do, and we just need more people to vaccinate. We've had, in the last 30 days or so, over 50 people have died from COVID in Shelby County, and almost all of them are preventable. Get the vaccine. And it's not just a personal decision. If you're 25 years old and you're saying, well, I'm fine, I'm healthy, I don't need it. You not getting the vaccine hurts others, because there's kids under 12 who can't get the vaccine. So if you're not vaccinated, you are more likely to catch coronavirus and more likely to transmit it to someone else, more likely. So, and since half our country has not been fully vaccinated, it's allowed this disease to spread more, to morph more, and that's why we have these variants. And the variants are going to become tougher and tougher. So it's not just a personal decision. Your decision not to vaccinate is negatively affecting other people. So please do it. It's safe, it's effective, and it's life-saving.
And Mayor, regarding vaccinations, what's your stance? And I realize a lot of people will want to know on having maybe City of Memphis employees be vaccinated before they come to work.
Sure. First of all, we probably do not have the legal authority to do it. But even if we had the legal authority, and I want every city employee to be vaccinated, we're offering a $250 incentive to do it. We're allowing paid time off to do it. We have been for a long time. But the challenge is, if you're the only major city I know who's done it is Denver, Colorado, and they did it about 10 days ago. But when we're already short of police officers and firefighters, and a city mandates vaccination, and you lose 50 or 100 firefighters and police officers, that's a long-term damage to your city that we can't get over. So I just don't feel comfortable when you look at the big picture of mandating vaccinations. But we're going to strongly encourage it. We're going to incentivize it. We're giving people time off. And our hope is our numbers tick up.
Well, and in fact, to that point, there have been concerns that with several of our area hospitals now mandating employee vaccines, that at a time when hospitals are stretched more than ever, they will lose employees. Have you, and I know you have no governance over that decision, but have you been in talks with these corporate leaders, and do you hear from other corporate leaders that they want to go that way?
Yes, I have talked to many, and it's a struggle. They're having the same thoughts that I've had. There is a nursing shortage in this country. Even before the pandemic, there was a nursing shortage. The pandemic has pushed that to a dangerous level. And right now, our hospitals are bursting at the seams, which is another reason we need to ask people to get vaccinated. It's not just a personal decision. Because if you get sick and you have to go to the hospital, our hospitals are to a point now where they're having a hard time taking care of all the patients. And there's going to be a delay of care for those facing real emergencies, heart attacks, strokes, if the hospitals are overburdened by COVID patients. So that's another reason. It's not just a personal decision. Your decision not to vaccinate is negatively affecting others.
Mayor, on another issue, I know it's been a couple of weeks now since our new police chief, C.J. Davis, had a chance to visit the White House. And of course, there were discussions about federal dollars being used for in several cities, including Memphis, to help fight crime. Where do we stand there a few weeks later?
Sure. In particular, the White House wanted to work with us because we're both interested in gun violence interruption. In short, that is getting people out on the streets, talking to these young people who are in gangs, who are shooting each other or potentially could be shot, and pleading with them and working with them not to retaliate. We have interveners out on the street right now and have for the enhanced effort for 30 days or so. And we have about 25 interveners out on the street right now. And if there's a shooting that's gang related, they are intervening with that group, trying to talk them out of retaliating and trying to get them on the straight and narrow. It works in other cities, like Oakland has reduced gun violence pre-pandemic by 50% or so, and it's too early to say if it's working here, but that's what we're working on with the White House, and they're going to send some resources and some advisors to Memphis here in the next 30 days.
All right, we'll take whatever help we can get. Real quickly, any talks with the governor about potentially reopening the Commercial Appeal Building as an alternate hospital, although with staffing issues that we just discussed, it might not help?
If there are discussions, I don't know about them. I think the hospitals, even though they are really under pressure, they've not asked for that help yet, as far as I know.
All right.
All right.